Hello and welcome to Unit 87, which is administer medication to individuals and monitor the effects. You've been doing this in numerical order. This is now your last unit, so well done. If you skipped some units and gone to this one first because you think it's a little bit more fun, well, unfortunately, you'll have more to do. But let's move on to this one. So, administering medication to individuals and monitoring the effects. It's quite clear that from time to time, we will be assisting people to provide medication. That may be prescribed medication or homeopathic remedies or over-the-counter medications such as paracetamol. It's important throughout that we understand what we're given, when we're given, and who we're giving it to. We follow the right medication procedures. You will have already completed your online medication training, you'll have watched the videos, and you will have done your medication content, which will be used as supplementary evidence to support this. Let's look at unit on the learning outcome 1. Understand legislation, policies, and procedures relevant to administration. We know that around 1.1, identify current legislation, you have the Medication Act, Controls of Substances, Hazardous to Health, Health and Safety at Work Act, and again, RIDDOR reports. There's many other medication legislations out there, so again, you'll have covered those in your training. Our policies and procedures can be found online alongside your medication training. We follow the 10 R's, so the right route, right person, right dose. You'll be fully aware of those, and you should be able to identify those within your answer. Number 2 wants to know about the common types of medication. So, 2.1 describes common types of medication, including their effect and potential side effects. So let's just look at some of them in which you could do. Now, for this, it would be useful for you to have a table. So you could have a table for pain medication, for example. So you've got pain medication here, types of medication there, could be paracetamols, ibuprofen, or opioids. Their effects are about blocking pain, reducing inflammation and swelling, and helping the person to recover from an injury. Their potential side effects of pain relief is generally things like constipation, feelings of sickness, dehydration, and feeling thirsty. So let's move down to other medications such as constipation medication. So common types of medication would be laxatives. You may have Senocot. Side effects for those are things such as loose bowels, which you would hope because that's what it does. Again, it could be things such as feeling sick, rashes, etc. So again, you can just list those on the table. You may have medication for mental health. Common types might be antidepressants or SSRIs, serotonin inhibitor up. They're designed to promote natural serotonin in the brain and to release that feeling chemical in your brain that helps you feel again. Side effects of those could be dehydration, the feeling of sick or nausea, and the potential side effects could be suicidal thoughts or depression. So here you need to list the types of tablets of pain relief, constipation, physical health, mental health. List a couple of the medications and then list some of the side. 2.2 wants you to identify medication where you need to measure physiological measurements. So physiological measurements might be things such as pulse, blood pressure, glucose. So let's give you a couple there. Insulin for diabetes will need physiological measurements done. You'll need to measure the blood glucose beforehand. So it's important that we do a physiological measurement. We establish what the reading is, should be between 4 and 7, and then we're able to administer insulin. The diroxin, which is a medication for around bloods and hearts, etc., you could take those, and it's important that we check your pulse rate. Pulse is low, we wouldn't give it because it slows your pulse down. So it's important that we record your pulse rate. Warfarin Again, we could be doing pulse rates and blood pressures. It's important we do those beforehand, as we need to make sure. So again, measuring your blood pressure is important beforehand. So there are medications out there where it's important we take physiological measurements. 2.3 wants you to describe common side effects and reactions to medications. So common side effects generally are things such as rashes, swelling, asphyxiation, constipation. Sometimes it could be loose bowels. They could change your mood. So common side effects are very typical in a lot of medications. 2.4 wants to explain the different routes of medication. So again, you will have covered this. As somebody who's assisted medication or dispensed medication, you can give medication orally, through the mouth, or topical, as creams. If you're a nurse or you're trained to do otherwise, you could do rectal medication, injections, or absorptions, drops through the eyes and ears, or inhale some spray. So understanding procedures and techniques for administering medication. 3.1 wants you to explain the types and purposes and functions of materials and equipment needed for medication via different routes. So oral, taking it through the mouth, we should have our medication pot and our spoons, because again, we should be doing non-touch techniques. If it's injections, we'll need subcutaneous injections. Again, we would clean the sites, we'll need them to clean. We would have our injections, our sharp pins. We may prepare those for the customer, so it might be things such as the diabetic flexi-pens. And again, we would prepare those and hand them to the customer to do. We would need the sharp pins and the microfilter tips. If it's topical creams, we would need gloves if we're going to rub it on areas. And again, pea-size amount, and we would use that. And again, if it's suppositories, we would need gloves and maybe some kind of a petroleum jelly, KY jelly, to assist medication. 3.2 wants you to identify the required information on a prescription or medication chart. So you would have covered this again in your medication training, but just so we're aware, you'll have the name, the date, the dose, the amount, the frequency, the route, who it's for, and obviously the name of the medication. Section 4 wants you to prepare for the administering medication, and again, you will have done this in your observations, so your medication certificate will demonstrate that you can do this. 4.1 wants you to apply standard protection for infection control. So we know good hand washing, good PPE for gloves and aprons. 4.2 wants you to explain the appropriate time of medication. In other words, going to the MAR chart, checking the times, and obviously making sure if they're not taken. If it's a PRN medication, so it's a medication as when required, that the charts are being completed on the back of the MAR charts, and we're making sure that the medication hasn't already been given. We may ask them to confirm that, or other family members. 4.3 is about obtaining consent. So again, we would tell them what the medication is, offer them reassurance, and encourage them to take the medication. 4.4 is about selecting and checking correctly preparing the medication in accordance with the MAR records or the leaflets, and you'll be observed doing this. Ideally, you should be using the non-touch technique route. So again, if you've got packets, pop it into the pot. Administering the medication, administering and monitoring the individuals during the medication round. So you should be able to select the route for the medication according to the care plan. But again, that's as the medication should be given, normally orally. 5.2 is about safely administering the medication in line with the legislation and protocols. So that's about making sure you're minimizing pain and discomfort. So we need to know about our patient, our personal approaches. Are they able to swallow? Do they want one tablet at a time? Will they take 2 or 3 at a time? Do they take them with water? Now, to minimize pain and discomfort, it's useful to give them a drink beforehand to lubricate the throat. Give them the medication, so again, it doesn't sit in the mouth. Give them more fluid to wash it down, and again, give them further fluid to wash any residual medication to avoid thrush. You should be able to describe how to report immediate problems. So if you did see any adverse reactions, what would you do? Hopefully you'd go to first aid principles. But again, you would report things on the mark charts and or to your line manager. 5.4 is about monitoring the individual's condition. So making sure that you watch them swallow, ask them to show you afterwards. Watch the gag reflex and make sure that the medication is down. If you see that they're constantly struggling to take medication, maybe it's time for a medication review and go for an alternative medication, such as liquid medication. 5.5 is about explaining why it may be necessary to confirm that the individual is actually taking the medication and not passed the medication to others. Sometimes people may store medication. They may be storing it to harm themselves or harming others. Therefore, if you're signing to say that you've seen medication being given, you're signing to say that you saw it taken. It's really important you follow the tablet. So if you're signing for it, you have observed that tablet from it being dispensed to it being consumed. 5.6 is about maintaining security of medications and related records throughout the process. It's important we don't leave MAR records lying around because of GDPR. They are people's data. They have their date of birth and other confidential information. If you're trained in medicines, you'll be able to understand a lot about somebody's health and well-being. For example, if you know somebody's on PrEP, you may think that they've got HIV. That may have been private and confidential, but somebody's seen that record and put two and two together. So it's important we maintain the security of MAR records and medication records. It's important we don't leave medication lying around and that at all times it's secure. And if we are the medication holder with the keys, those keys remain on us at all times. It's important we don't leave medication lying around because it can be consumed and it's harmful. We should follow COSH data records. 5.7 is about how to deal with out-of-date or part-use medication. Ideally, in your services, you'll have doom kits or a refusal bag. Again, the chemist should have refused medication from back to them. So it's important that we follow those guidelines. Let's review what we've just covered. So in Learning Outcome 1, it was about understanding legislation and policies. Here we have legislation, Medication Act, Misuse of Drugs Act, Health and Safety at Work, and then the Health and Social Care Act, but it's now the Care Act 2014. Regulations and guidance around the misuse of drugs, domiciliary agencies and controlled drugs, which means they must be supervised and managed. We have protocols as well, such as NICE guidelines, and obviously our own policies and procedures. Here, it gives you a list of common types of medication: antibiotics, anti-inflammatories, antihistamines, cardiovascular, and again, you should know what they're for. The potential side effects we discussed were rashes, constipation, dizziness, and nausea and dry mouth. Occurrences are about when a side effect happens, and it gives you an idea of whether it's very rare or very common. Obviously, the more common it is, the more we should be vigilant on that person. Physiological measurements such as insulin, we discussed already. Warfarin, we discussed again, and digoxin, checking. Again, we covered. Okay, number 3, understand procedures and techniques. So we covered the administration techniques as in oral, cups and spoons, topical, wearing gloves, insulin, again, gloves, rectal, vaginal, make sure gloves and aprons which are needed. We talked about medication chart, name, age, medication, dose, frequency. Learning Outcome 4, preparing the medication. Again, in agreed ways, good hand washing, good PPE, cleaning the areas and disposing. And again, consent, making sure that we gain that consent throughout. Admission and monitor the individual's condition, again, depending on how it's given. We would follow the administration records and MAR charts, record and observe any adverse reactions as we've already. So there's some recommended reading there for books. and lots of useful websites to help you off this unit. As I said already, we have our own medication page in where you can do extended and further reading. So it's important you to go on there, and again, you can become a medication champion. It's important you do your online video and you're tested annually for your competencies for managing medication. Thank you for watching. I hope you found this useful. Again, you'll need to download your workbook, complete that, and email it over to your assessor. Thanks for watching.